Hello everyone, I Dr. Nikita welcome you in my Pharma online channel. Like, share, subscribe my channel and keep watching my videos till end for the better understanding. So today we are going to see classification of dosage form. So dosage forms are classified based upon four criteria: the physical state, route of administration, site of action, and the usage. So, physical form, which form it is, based upon that it is classified, whether it is solid, liquid, semi-solid, or the gaseous state. For these dosage form classified based upon the physical forms. So solid, you have various example like tablet, capsule, granules, effervescent tablets, powders, dusting powders, lozenges, pastils, pills. So these are the various solid dosage forms. Next you have is the semi-solid dosage form. These are the like suppositories, pessaries, ointment, gel, paste, jellies are the example of semi-solid dosage form. You have liquid dosage form, that it includes the lotion, liniment, elixir, syrup, aromatic waters, spirit, colloidons, emulsion, suspension, mouthwash, mouth throat paint, gargles, eye drops, ear drops, nasal drops. So these are various liquid dosage forms which you can use. Then you have gas. So these are the basically various aerosols, inhalations are the example of the gaseous dosage form. Various sprays are also available. Next, you have the miscellaneous that includes the novel drug delivery system. So, novel means new. So, it is a combination of various advanced techniques you are using to make it better than the conventional dosage form. So, this may be a medicinal device or may some use of polymers which makes it better better for the drug release or the therapeutic action compared to the conventional dosage forms. So these are some examples of these various dosage form classified based upon the state, whether solid, liquid, gaseous, or semi-solid. Another classification is by route of administration. There are various routes through which you are administering the drug. You have ocular route, nasal route, oral route, topical route, parenteral route, sublingual route, buccal route, vaginal, rectal, various routes are available through which the drug is administered. Once it is administered, it enters into your body, and what is happening that we will see in this slide. So you can see this diagram where you can see the organ system and the circulatory system. You have digestive system, you can see lung, then heart, kidney, and network of the blood capillaries, arteries, and vein which is carrying the blood. So when you administer the drug through oral route, that this black arrow you can see which is representing the oral route, it enters into your digestive system, goes into your stomach, then liver, intestine. In liver, the part of the drug is getting metabolized, and after metabolism, it is getting pumped toward the heart, and from the heart, it is getting circulated throughout the body. So, whatever is remaining into the intestine, it is moved toward the rectal region and it is excreted through the stool from the body. And the drug is getting filtered into the kidney because when the filtration of the blood is taking place, the toxins and the various metabolites of the blood are getting filtered out through the kidney and getting eliminated urine. So this is the oral route which is followed by the drug, and many formulations like tablet, capsule, syrup, aromatic waters, elixirs you can give through this oral route. Now this oral route you have another two routes which are at the same location in the mouth, that is sublingual route and the buccal route. Okay, so the buccal route means it is in between the gum cavity and the cheek, and sublingual root is below the tongue. So when you place small tablets or the uh, films, buccal films or sublingual films, they get absorbed directly into the systemic circulation because these mucosal membranes have rich supply of this capillary network. It enters into the systemic circulation. Now next you have nasal and the inhalation route. These are the color arrows you can see when they enter into this mouth, and when enter into the pipe it goes to the lung. And the nasal you can see when the drug is applied in the form of spray or the nasal drop or the aerosols. The nasal mucosa is having also a rich capillary network, and through this the blood is getting absorbed into the systemic circulation. Next, you have ocular, that is the eye. You can insert the lenses, insert then implants. You have the ointment gel for the ocular route. Now, again, eye mucosa is also having the blood supply, rich capillary region from which the drug is getting entered into the systemic circulation. You have topical and transdermal route. Topical means a local part or the spot where the drug action is required. So at that particular region you are applying the formulation, and there the drug action is getting exerted. So ointment, cream, lotion, gel, sprays and various patches you can put onto the skin for having the local action or the topical action. Transdermal is when the drug crossing the skin and entering into the capillary region. From there it enters into the systemic circulation and it avoids the first pass metabolism. Next, you have rectal and the vaginal region. So, rectus and the vagina, you can have suppositories, pessaries, cream, ointment, some powders you can use for this roots. Rectal, again, the recta, you have the mucosal lining of the rectus is having the rich blood supply and capillary network. So, when the drug reaches there, it absorbs into the systemic circulation and circulated throughout the body. Now you have the parenteral route. So as the name indicates, parenteral. Enteral means oral and pars mean other than. So other than oral route, it comes into the parenteral route. So it is basically a drug introduced directly into the systemic circulation via injections. So many solutions are injected: muscular, intramuscular, subcutaneous injection, intravenous injection, and the dermal injections. So directly entered into this purple color arrow, you can see where the drug is directly introduced into the bloodstream. So 100% drug is available with no metabolism from this parenteral route. Otic route, it is the ear cavity. You can instill ear drop or you can put ear ointment for the local action of those formulation. So if you see various routes, these are the major routes through which drug is administered. It goes to the systemic circulation or it goes to this organ system, and then it entered into the systemic circulation. After circulation, blood is passing towards the kidney where it is getting filtered out and drug is eliminated into the urine. So when you take a drug, it goes the absorption, distribution, metabolism, and elimination. You must have observed when you take the medicine, the stool color is changing, urine color changing. You feel that smell of the medicine when you urinate, when you pass the stool. So these are the drug entering into your urine, entering into the stool, and getting eliminated from the body. So these are the various routes through which drug is administered and how drug is following the path, and at the end it is getting eliminated through the body. Now you have various uses like internal use or the external use. Now internal use drugs you are taking orally, it is going to your internal organ, entering into the systemic circulation and exerting the effect. Now external use, basically these are the topical formulation when applied to the skin. they're giving the effect. Suppose you have cut, burns, any skin infection, you're applying at that particular region, and the drug action is exerted at that spot, and it is getting healed. When you have headache, sometime you put an ointment and you feel the relief from the headache, but you do not take the tablet. So that is the external use. When you have ear pain or ear infection, sometimes you put the ear drop or ear ointment and you get relief. So that is the external use. You do not put medication into the mouth, it do not go to the inside of your body. So that is the external use formulations. So these eye drops, ear drops, these are the example of the ointment lotions which you use for the topical purpose to apply onto the skin part. These are the example of the external use formulation. So these are the classification of the dosage form which we have seen based upon the physical state, route of administration, use, and the site of action. Site of action means where you are applying, whether you are applying onto the skin, hand, eye, ear, various different sites where you are applying. Based upon that, they are classified. So kindly like, share, subscribe my channel and keep watching it for better understanding. Do not forget to post your comment. Thank you very much.